Welcome to this episode of Lifestyle Matters. I'm once again joined by Dr. Ferghal Armstrong to continue discussing social isolation and social relationships. Welcome to this episode, Ferghal. How are you doing?
I'm very well. Thank you, Saveena. Thanks for having me back.
So I thought today we'd talk about a bit more about social isolation and relationships. I mean, we established in the last episode what the risk factors are to develop loneliness. We've also established that 1 in 3 Australians before the pandemic experienced loneliness. We can only imagine that now it's more frequent. And the fact that we all feel lonely from time to time, and the issue lies when this loneliness ends up being prolonged and starts having a negative impact on our health. There are lots of studies we have looked up to suggest it has various negative impacts. Lots of it are still in preliminary stages, lots of theories behind it. And I thought it's a good idea for us to just talk about it so that we can increase everyone's awareness about it. So, Ferghal, did you want to start by talking about what your take is on the fact that loneliness can affect our health? How does it affect our health?
Yeah, so again, you mentioned there's a lot of research being done in this area, and I think it's important to emphasize that it's very difficult to prove causation. It's much more easy to prove association. The only way you would prove causation is with a randomized control trial where you would forcibly make one group of people lonely and just watch another group of people, which would act as a control group. So that's really unethical. So it's association. But the bigger the trials, the more we can actually derive data from it. And we know that loneliness is associated with harm. And, would you believe that? That actually feeling lonely is associated with a 30% increase in the rate of early and premature death. That's staggering. And we know that is as an important risk factor for early death as smoking. And it's worse than obesity in terms of the impact on longevity. So really, the way we see these adverts on well, not necessarily on TV anymore, but, we have adverts on or warnings on cigarette packages, smoking may cause harm. We don't have such warnings for loneliness, do we? But loneliness is as important a risk factor for death as smoking.
Yeah. And it's interesting you started, I'll just pick up on what you mentioned about it's easy to prove causation and association. So there was one study that was quite famous, the Brigham study, where they were what they did was basically in a nutshell, looked at studies done years before and looked at the risk of loneliness and living alone with heart disease and premature death. And they found that there was quite a high link. There is evidence. It's just that the way the studies are done is a bit different compared to the normal studies we know.
Yeah. So that's a useful segue into, having a look at about the effects of loneliness on kind of systems. So we know that it increases the risk of death, but let's delve deeper. So the cardiovascular system, the Birmingham study told us that it increases the risk of cardiovascular disease, and that includes strokes and heart attacks. Would you agree, Saveena?
Definitely. And I guess there's also, and one of the reasons behind it is got to do with the risk factors. And risk factors, they found that blood pressure is increased in people who suffer with loneliness. And I guess the other thing is, substance use, alcohol and smoking comes with loneliness. And those we know are risk factors for heart disease, for things. So.
Yeah. But isn't it amazing that loneliness actually is a risk factor for high blood pressure? It's a risk factor for high cholesterol. It's a risk factor for putting on weight. It's a risk factor we can kind of intuitively understand why people resort to smoking if they're feeling lonely, because it does make you feel better. And so too does alcohol. But loneliness can be seen as a cause of blood pressure and cholesterol problems and putting on weight. And all of this leads into an increased risk of heart disease, as you say. I mean, it's amazing how the feeling isolated permeates into physical systems.
And that would be definitely be. And the other thing I would say with that is also, we talked about premature mortality. When you think about it, and now that we've actually lived through, a pandemic, we actually understand why people, and I don't know about you, but I find this in general practice where people are delaying preventative healthcare. They are avoiding going for cancer screenings, blood pressure checks, and, there is no surprise there why we pick up these things now much later. So cancer diagnosis, someone having a silent heart attack and not realizing that they've had it, poorly controlled diabetes. People are avoiding going out, and people avoid, they just live by themselves and they come into this sort of little shell and don't go out to get help. And that's another reason why we actually find these.
So that's a secondary downstream association is poor healthcare literacy and poor healthcare accessibility because of isolation.
Yeah. That's right.
So go on.
And the other thing I want to talk about when you talked about heart disease is there was actually a study where they were looking at patients who suffer with heart failure. And there was a much higher chance of risk of death, hospitalization, just because they were socially isolated or lonely. And once again, it's for a variety of those reasons that we discussed, poor diet, poor, not accessing medical help when they need to, not attending regular appointments with their doctors. So I guess what we're trying to say is it's not just the physiological things, isn't it? It's also the secondary reasons for it. Yeah.
And I suppose that also highlights the benefit of a therapeutic relationship between a patient and his or her doctor. Even going to the doctor for a chat over nothing in particular, if that's part of how you prevent loneliness, well, that's a valid reason to talk to your doctor.
Laughter is the best medicine, Ferghal.
Well, it is, isn't it? It is.
It is, definitely. And that's actually a very useful segue into the other thing about loneliness, depression and anxiety and mental health.
Absolutely, yeah. I mean, the figures are absolutely staggering, 50% increased risk of dementia, 29% increase in heart disease, we've spoken about, 32% increase in stroke. Loneliness is associated with higher rates of depression, anxiety, and suicide. The impact is enormous. So if we look at dementia first of all, and then we can go into anxiety, depression, and suicide. I mean, first of all, what is dementia?
Well, basically, dementia is a neurodegenerative condition of our brain, and what that means is that our cognitive function starts declining. That would be my take on it. How would you sort of describe someone who suffers with dementia?
Well, I think it's important to understand that dementia is really like a zoo, because there's lots of animals in zoos and there's lots of types of dementia. But when we use dementia loosely, I suppose we're referring to the dementia of the Alzheimer's type, which is particularly characterized by a gradual degeneration of the brain function, including a loss of memory, a loss of executive function, so the inability to problem solve and manage things. I often think about people with dementia having struggles if they lost their wallet. You and I would be very stressed, but we'd know what to do. We'd have to start calling up the bank and canceling all our credit cards and applying for new ones, getting new PIN numbers, et cetera, et cetera. Someone with dementia would not be able to do that. So that's one of my kind of, that's how I think about the impact of dementia on people. And we know it's a very slow, gradual process, and we know that it's associated with certain processes in the brain that are purely physiological. And now we also know that these processes in the brain are accelerated by loneliness. So we have an environmental risk factor for internal processes in the brain, which I think is amazing.
Yeah, and I guess we've just got to also remember that, one of the other differentials for dementia is depression, and that comes once again with loneliness, and sometimes that can be exaggerated by mental health.
Absolutely,
Yeah, and then the other thing you talked about was the other type of, there are several different types of dementia, but I guess what I wanted to point out was the vascular dementia type, which comes again with, the cardiac disease, the high blood pressure, the cholesterol, and all those sort of things. Those are the risk factors for vascular dementia. And once again, if you've got those risk factors, your risk of vascular dementia is higher. And that, once again, then can cause, and once again, that's all really goes back a few steps down to loneliness and things too.
And I suppose that also feeds back into, the idea of brain health and what physiological parameters do you have to have for brain health. Now, the Americans have developed these parameters, those things like having a normal BMI, having a normal blood pressure, having a normal glycemic control, normal cholesterol, predominantly plant-based. We're getting this theme again, predominantly plant-based, vegetarian diet. But in that list of parameters, they have not said socialization. And really, what we're trying to say is actually socialization, it plays a crucial part in the maintenance of brain health and the prevention of the initiation and the progression of dementia.
Definitely. And with socialization, hopefully you would be also doing it with other people where, potentially maybe doing a crossword puzzle together or doing some exercise together. And we all know all that actually reduces the risk of accelerated dementia.
Yeah. So I suppose that's one of the benefits of socialization is, as you say, that it encourages other healthy activities, not just mental activities, but also exercise. So going for walks, cycle rides, etc. And that all plays into, the improvement in lifestyle. So socialization treats loneliness and improves behavior.
Yeah. And I think, there are lots of different suburbs and towns have like community groups and things for the elderly, which I think is a really good thing. I know lots of places where we work that's been, sort of on the down low currently because of COVID. But, I think that's actually a really good system to have so that we can promote socialization amongst the older people where they actually do more, exercise and socialize and, just be active and to reduce the risk of dementia. Yeah.
So we've talked about dementia. I mean, what about depression and anxiety? How does loneliness affect depression and anxiety?
I mean, you think about it. If you're alone by yourself, you spend all the time alone and not actually communicating with someone. We are all social beings. We're meant to be in a tribe. We're part of a tribe. We're not meant to be alone in this world, generally speaking. And when you don't have that social relationship where you can talk to someone, communicate, bounce off, emotions and things with each other, that would make someone feel pretty depressed.
Yeah.
And that can also heighten anxiety. Like I'm seeing it happen right now. People who've been in social isolation now coming out, trying to live out in the normal world, and their anxiety is through the roof. And that's just because they've been sort of, just caged in and not being socializing with other people. And now the thought of just merely going out to the shops increases anxiety levels.
Yeah.
Yeah.
So it worsens depression, it worsens anxiety, and it increases the rate of suicide. I mean, that's a terribly sad thing to think about because remember, loneliness is a reversible condition. Yeah. So I mean,
definitely.
these days, how are you days? I think they're a great thing because it really encourages us all to consider how other people around us who may not appear distressed actually. It encourages to actually ask them how they are feeling because really for the want of one social connection, someone may actually go on to take their own life. And that's such a travesty of justice, that someone for the want of a social contact is dead.
Yeah. Yeah. Well, I guess I suppose in terms of, we know that one of the risk factors for suicide is living alone.
But I should emphasize that it's not necessarily just living alone. As you've said previously, there's a difference between being alone and feeling alone, isn't there?
Yeah, definitely.
Yeah. So I think it's more important to emphasize it's feeling lonely because, what about people who feel lonely but live in the middle of cities? They're surrounded by people. They're surrounded by access to services. They can still feel terribly lonely.
Yeah. Yeah, so I guess, so we talked about dementia and depression and mental health. should we just quickly touch base a little bit on substance abuse before we just talk about what we can do to help reduce loneliness?
Well, we know that loneliness worsens mental health. We know that mental health leads to substance abuse. And then we also know that substance abuse leads to worsening mental health. And we also know that substance abuse erodes people's identities. When people start out, with substance misuse, they're still connected with society. They're still connected with their loved ones, their friends. But as the substance use progresses, they gradually are unable to meet their social obligations, their role obligations. So by that, I mean, they're not able to pick up the kids from school. They're not able to make dinner for the family. They're not able to go to work on time. So they lose function because they're not able to meet their role obligations. And then that has downstream effects because then it causes them to lose their personal relationships. So it strips away from them all of their validating, healthy personal relationships. So one of the key features of someone with a substance use disorder is they don't have any friends who aren't using substances. Yeah, that's what we see in people with extreme forms of substance abuse who are living very chaotic lives. All of their social relationships are dependent on that substance. And so that's how I define the descent into the chaos that is substance use disorder. And that is also how I define recovery. I define recovery in no small part by the reacquisition of healthy relationships with people who do not use substances. Again, it boils down to relationships. So substance use disorder causes us to lose our relationships, and recovery is the process by which we regain our relationships. And that feeds into loneliness. I mean, we also know that even within that cohort of patients who do have substance use disorder, we know that they identify loneliness as a significant problem. Like 70% of people in one survey said, in the last month, I felt lonely. Loneliness also impacts upon the way that patients with substance use disorder perceive the way that services are delivered to them. So they feel stigmatized, or they're more likely to feel stigmatized by the way that they're handled or they're treated by services. And we actually know that loneliness worsens substance use. There's very good evidence that the more lonely you feel, the more likely you are to increase your heroin use. So, it sounds like a tangled web.
Yeah, and it sounds like the relationship between loneliness and or emotionally overeating too. It's a bit of a vicious cycle, isn't it?
Absolutely. I mean, food is a substance. Anything that is misused.
Yeah.
If we go to the definition of what addiction is, it's repeated engagement with a rewarding stimulus despite negative repercussions. So if you can apply that to food, you can apply that to heroin, you can apply that to ice or speed. So, especially, what we call hyperpalatable foods, the foods that are rich in salt, fat, sugar, and refined carbohydrates, these are, these binge eating episodes are repeated engagement with a rewarding substance. Well, it's rewarding because it makes us feel great, despite the negative repercussions of metabolic syndrome, et cetera, et cetera.
So what I'm hearing here is that it just comes down to sort of building positive social relationships amongst people. And, that's basically it. And once we do that, we may be able to sort of overcome loneliness. But it's easier said than done. I appreciate that it's not easy for everyone to do that. But little steps, I guess, is what I would say. Just sort of practicing compassion to each other. Understand, try to put yourself in the other person's shoe and just imagine what they might be feeling, what they're going through, being kind to each other. And it comes down to just the very basics of humanity, doesn't it, Ferghal?
It does. I suppose we can talk about this in the next episode, is how do we actually improve our relationships. But the key thing is, our own humility is the gateway to establishing relationships with others. When other people think we're judging them or we feel superior to them, that's the end of any potential for a relationship. So maintain our own sense of humility.
Yeah. Well, on that note, Ferghal, I think that's a great way to end today's episode. I look forward to chatting with you again about how we can potentially build better social relationships with others the next time. Thanks once again for joining us, Ferghal.
Thank you.
Thanks for joining us on today's episode of Lifestyle Matters. We'll see you next time.